Okay, guys. Welcome to Fertility Talks. I'm Mary Wong. I'm the author of best-selling book, Pathways to Pregnancy. I'm the founder and director of one of North America's leading fertility clinics in Chinese medicine and naturopathic medicine, holistic health anyway. And I am a fertility strategist and acupuncturist. So today we are going to talk about the COVID-19 vaccine and impact, or look at it in relationship with pregnancy and fertility. And tonight we are going to speak with Dr. Ari Baratz, who I so love having with us as always as a guest. So thank you for being here.
Thank you, Mary. You always make me smile. I really do have to applaud you as a professional, the fact that you're committed to being up to date and interviewing many different professionals about any topic, but especially with COVID-19 being the topic of 2020, and unfortunately probably the topic of 2021 as well. Mm-hmm. So thank you for maintaining this platform. And I think it goes without saying that everything we talk about should be at the discretion of individual patients and their providers. We're talking in very general terms. And ultimately, everything we talk about is news today, but tomorrow there may be new findings. So it's an ongoing conversation.
Absolutely. And so before we get into the meat of this topic, let me formally introduce you for those of you who are just joining us for the very first time. So Dr. Ari Baratz is a reproductive endocrinology and infertility subspecialist at Create Fertility Centre in downtown Toronto. And he's also a staff physician of the Department of OBGYN at Women's College Hospital, as well as Sunnybrook Health Sciences Centre, and the faculty Department of OBGYN Division of Reproductive Endocrinology and Infertility at the University of Toronto. So that's a mouthful. And Dr. Baratz has been dedicated to women's health and reproductive medicine for over 20 years, specifically dealing with infertility and recurrent miscarriages. So thank you for coming on again. And you have been really the key person that has kept us abreast of the COVID pandemic and all its nuances from the get-go. So, really thank you for being here and sharing all the information with us. And it's a discussion tonight.
Well, I really do think the role of professionals in general are to provide the color commentary. But as mentioned, the specifics are still coming out, and we do have true leaders in immunology. We have our medical officers of health, and we really have to follow their guidance. I see my role as being a bit of a translator, is taking this information and putting it into context and trying to assimilate all of the ongoing news. I mean, as of just a few days ago, our societies, the ones that we subscribe to, the Canadian Fertility and Andrology Society, the Society of OBGYNs of Canada, announced they would have a joint task force that they did publish an actual position statement, but in bold is also mentioned that all of those comments are subject to change and evolution as we learn more and more. But I think one thing we should just remind everybody is that even though we're all suffering from COVID fatigue, COVID exhaustion, COVID is real, and you don't need me to tell you that. As of the most recent data, there's been just shy of 2 million deaths worldwide, 1.7 million people. In Canada alone, we've had 500,000 people affected and close to 15,000 deaths. And that's across the population. Granted, most are over 60, over 70, but we're seeing COVID in every population group. And specifically our discussion group today, our population of interest are the reproductive age women. And in particular, pregnant women, people planning pregnancy, lactating, preconception, consultation, all these people that you'd be seeing, what I'd be seeing in my clinic.
So then on that note, have you yourself seen and witnessed women, whether they are trying to conceive or actually pregnant, contract COVID?
Well, that's interesting, right? Because most people that are suspected of COVID or contracting COVID are not going to show severe symptoms, right? Like 95% of people will move through our population and we'll never identify them.
Yeah.
So we have identified COVID positive people that have been in contact with our clinic. And as a result, we've had to, go through the usual TPH, Toronto Public Health protocol. Fortunately, none of them have direct contact. It's been like contact of a contact,
Right.
but still that requires testing all those around. And I don't think there's been one facility or one institution that hasn't had to engage in a COVID protocol.
Yes.
I'm sure in your clinic you've had situations where staff have had to stay home because of suspected. So fortunately, we have not had a real COVID case. I have not had to treat a woman who actually became COVID positive. But obviously we're prepared if that should happen. And so far I've not actually been directly involved in any of the severe COVID cases, which are what we're most worried about. So that meaning like hospital admission, ICU admission, which we know that in the pregnant or in the reproductive age women, pregnant women in particular represent about like 10% of them will have some kind of COVID hospitalization if they get COVID. And maybe about 5% will have severe symptoms like ICU or something of that nature.
Yeah, so we had a person call us, and she was actually pregnant, and she did contract COVID. And interestingly for her, she did not really get sick, not much. I mean, it was positive, but it was like I just felt a little funny kind of thing. So that was interesting to see.
Right. I mean, that's actually a nice lead in to vaccination, because that's one of the big fears with vaccination for a lot of people is that, will I actually get COVID by being vaccinated? Will I get very sick when I get vaccinated? What will I
Yes.
experience? And you have to realize that vaccination is not the same as getting COVID. In fact, that's how immunology works, is it sort of tricks your body into thinking, or teaches your body, if you are to see COVID, this is how you should handle it. So it's sort of like a training mechanism. And that's the beauty of the new vaccines that have been developed, is that they are very effective, like 95% plus effective at helping people traverse the whole COVID exposure without actually getting that sick at all. But vaccine aside, the burden of COVID is sufficient enough that we have to have these conversations. That's why the world had to accelerate towards a vaccine. And even now we're dealing with mutations of COVID. And that's why
Right.
you might see this second wave of travel bans and restriction, because that's what viruses do. They look for a new host. I mean, if we all get really good at fighting COVID version 1, then the vaccine has a bit of not a brain, but that's how biology works. It will try and mutate so that it can infect other hosts or find suitable places to propagate.
Absolutely. So I guess then, let's address some of these fears then, right? Because I'm sure you're getting it all the time as well. Should I vaccinate if the time when the time comes? And so the fear, one is that it may not work at all. So why bother? Second is the safety issue that you're speaking of. And there have been some people that have in the UK reported some allergic reactions.
Mm-hmm.
One I just found out about, I actually did not know. It was like Bell's palsy. So it was some neurological issue.
Mm-hmm.
Um, and of course, just, allergic reaction, right?
Right. Well, I would say paramount to anyone providing medical or clinical care is safety. Do no harm is what we subscribe to when we sign the Hippocratic Oath in medical school, and as we move through our medical training, and I'm sure you subscribe to the same thing, which is the
Mhm.
first thing that you don't want to do to someone is hurt them. If you help them, great, but you
Yeah.
don't want to harm. And that's what all of the phase 1, phase 2 trials are designed to identify. When you look at a new vaccine or drug or therapy, is, am I hurting anybody? Am I causing beyond just mild adverse reactions? Are people dying? And so far, the initial trials. I mean, remember, these vaccines were all developed within the last year, and trials go on for 2 or 3 years. So the vaccines that we are using right now, the one from Pfizer and the one that's coming from Moderna, have all been given a special status. So they were all expedited
Yes.
because of the need. And so it was felt that their safety had been demonstrated to a sufficient level that 6, 12, 18 months out, we're not going to see a radical change. We don't know for sure, but that's the
Right.
premise. That's the premise, that the safety is there. And remember, when you're launching something on such a wide level, that if it was felt that there was risk beyond a reasonable amount, you just wouldn't see the vaccines. I mean, look, even when we vaccinate, we're still going to have to mask, and we're going to have to do the 3 W's, right? You have to wash, watch, and wear, right? You got to wash your hands, you got to wear your mask, you got to watch your distance. Those are the 3 big W's, and they keep being repeated. I guess there's a 4th W, which is women. What do we do with them? Pregnant women. But so no one is saying that the vaccine is going to replace all of our public health measures. It's just saying that hopefully in a more rapid way, we can open up more and be more comfortable. So safety-wise, at least the populations that were studied, so people over 16, males, females, not pregnant, looks good, right? Like the adverse reactions have been very minimal. The most common reactions have been low-grade fever, some muscle pain, muscle ache, a bit of feeling unwell. But the Bell's palsy, the Guillain-Barré, the severe neurologic are very uncommon.
Right, exactly.
Now,
But people can focus on the most severe, right? And then they get
well, I think a real fear, and I mean, I think it's unlikely, is that when you start to launch beyond 40,000, whatever the number of patients were in each trial, that's the standard number. We start launching this to millions and millions and millions of people, you're going to start seeing these more rare reactions. But we have to ask yourself is, those reactions that we're seeing with the COVID vaccine, how different are they than other vaccination programs? We know that anyone that gets the flu vaccine has a very small risk of developing either a neurologic deficit like a Guillain-Barré or a Bell's palsy. So we're still talking really, really small risk, but what that has to be offset against is the risk of COVID itself. And that leads nicely into the whole pregnant women discussion, because right now, Canadian, American, European societies, professional societies are all advocating for COVID vaccine in those people who we feel the risk of acquiring COVID is greater than the potential theoretical risk of the vaccine. We say theoretical because it hasn't really been shown. We haven't studied these women, but the mechanism of the vaccine is such that it doesn't really support an adverse reaction like that.
Yeah, people still have, well, okay, so then let's talk about how this vaccine may be different to the old, adjuvants like aluminum. So it doesn't have that, right? And it's mRNA, so it's different.
Right. So so traditionally vaccines were usually broken down or dead or inactivated versions of an actual virus. So you would feed the immune system a dead virus, hoping that the host, the person being vaccinated, would learn how to deal with the dead virus, so don't get the disease. But theoretically, when you're giving someone dead virus, maybe it will become active, maybe it will do something adverse to you. So that's traditionally how vaccines have been developed. And in fact, some of the COVID vaccines are based on those traditional vectors, like an adenovirus. Like that's how the Ebola vaccine was developed. But the new ones, the Pfizer and the Moderna, use another type of material called mRNA, which is not DNA. It's not actual viral particle, but it's material, genetic material, that will code for a part of the virus. So it uses your own body's machinery to build parts of the COVID virus that are not active. And that, therefore, when you do see COVID, if you ever do, you will know how to deal with it. In fact, everyone's seen that famous picture of the COVID virus. It has that corona, it has that sort of spike protein. And the mRNA that's given teaches your body how to build antibodies against that spike protein, which, by the way, that's one of the other myths that's come out, is that there is some overlap between those spike proteins and other proteins seen in human placenta. And so many have felt that because of that, it could compromise human fertility, that like the COVID vaccine could actually cause infertility, which is simply not true. It is
great.
Absolutely false. I think the only question that really rises around fertility would be if someone was to be vaccinated in the preconception phase, should they have some kind of waiting period before they conceive, like we do with the other vaccines? Theoretically, the answer there is no, they don't need to. But I think most have said maybe wait one month, or wait until most of these COVID vaccines are given in a schedule, like every sort of 3 to 4 weeks, there's an injection over 2 doses. Excuse me. And so Some suggested to wait till the schedule is completed, maybe wait 1 month, but there is actually no formal guideline on how long you have to wait, if at all.
You don't have any direction right now from the government, right? It's too early to know in terms of, they bought enough vaccine, at least in Canada, for more than our population. So how do you see
In
that
terms of
going?
the,
Is it going to
well,
be mandatory, or, are you going to make
right,
it mandatory at Create, for
right.
example? And
So first of all, there really are. I mean, living in Canada, we live in a democracy. We subscribe to autonomy, and so I think there'd be a lot of problems at the constitutional level, at the public health level, to actually mandate vaccination, like to say you must vaccinate or you can't go to work. Obviously, we know there are alternatives to being vaccinated: masking, distancing, washing. I think there'd be a lot of problems. Again, I'm not a lawyer, but I don't think that we would be able to hold someone's job against them if they refuse to vaccinate, unless they're in a high risk environment, right? If they're an ICU nurse, that's a different situation.
right.
Which again leads to the other problem with excluding women from the vaccine trials, is that a massive percentage of our frontline workers, healthcare workers, are female
Our women,
and
exactly.
reproductive age female. So it's caused a lot of problems for us to try to advise. So right now, I mean, even today, every day we're getting a flood of emails. And so our position is the same position as the CFAS SOGC position, which is if the risk of COVID outweighs the risk of vaccination, and in someone who works in a high risk area, we would support that. We are advising them to, if they have access to the vaccine, to get it.
Right. Okay.
Um, but there are other spin-off areas, like for example, let's say in the case of the Moderna Pfizer trials, where they identified people who incidentally got pregnant while they were in a vaccine schedule. Should those people be terminating the pregnancies? Is it that risk? And so currently there's no advocacy for that. No one should be terminating a pregnancy based on COVID vaccine exposure. Certainly this has to be in discussion with your physician. But again, another example of how inadvertently we've identified that COVID vaccine is still safe in spite of being pregnant or having an early pregnancy.
Well, and as you mentioned, I mean, when you use the vaccine, it's going to be much more, the dosing is so small relative to the actual viral load that you would get when you contract COVID, right?
Well, right. I mean, you're not really, so when you contract COVID, you're actually getting an active virus that has all the tools and messaging
Yes.
hijack. When you receive the vaccine, you're getting the potential to make a protein that teaches you. So you're really far removed, and that's the beauty of the mRNA, is that theoretically the experience should be safer, and so far that's what it's showing. But interestingly, the rollout of the vaccine is such a massive undertaking. I mean, the vaccine's under lock and key. We have the military in Canada and in the U.S. supporting this. I know that listening to some of the podcasts, maybe you've listened to the same ones. Just the courier shipping of the vaccine requires very special attention in terms of its temperature that it has to rest at, and in terms of just moving. Like apparently FedEx or UPS had to purchase a large dry ice facility just to have enough to support the
Wow.
movement. So, I mean, look, we're all taking this really seriously and we're trying to get everyone done, but this vaccine program is going to be at least deep into 2021. I mean, we're not, we need at least 70 to 80% of the population vaccinated to consider ourselves protected as a society, and we won't be there until the end of next year.
Well, see, when you say that, I'm like, well, how can we really get there when they mutate so much? And then I would say, then how effective is this vaccine when the COVID mutates?
Right. So it's still a COVID virus, right? So, I mean, mutations by definition imply that it's mutating, but it's not completely morphing into something different. So it's not going from a COVID virus to some other type of virus. I mean, it's going from a COVID virus A to COVID virus A.1. So there's still variations of the same, and they probably will still share homology. Like, I suspect that the virologist that designed an immunologist that designed the COVID vaccine selected the spike protein because that really represents the hallmark.
Right.
And even with multiple iterations or mutations of the COVID virus, you'll still have enough homology uh, between the various mutations that the vaccine will still work across
Hmm.
that. But again,
Okay.
we don't know.
Right. I mean, that's the whole thing. It's all unknown, but I
Right.
like the thinking. We'll see. I don't know. Well, I guess here's a personal question. So if they said, okay, you can vaccinate right now, Dr. Baratz, would you do it or would you wait?
Well, I've been very excited for the vaccine. I've been watching the studies, and um, I wish someone could, interesting, all these characters, like the president and vice president of the United States, and I believe the prime minister, like many larger than life characters have
Yes.
had their vaccinations carried on like live streaming.
Yes.
And so I know Sanjay Gupta had his vaccine captured. I would love to be the first fertility doc in Canada to be captured if you have a vaccine for me. Because if you understand the biology that and you follow the science, it makes sense. I mean, if you want to be consistent in what you do, but I can understand the fear. I mean, look, first of all, viruses in general are very scary because if in the last decade, we've been dealing with things like Ebola, Zika, West Nile, and some of those viruses have had quite devastating outcomes. Some of them have been very lethal, but not very pervasive, like Ebola. So that was more restricted in terms of its geography, whereas you had Zika, Zika, which was in many places, but it's very devastating on the fetus, like the small
Yes.
brain and the handicap. And so the issue with COVID is you take all this virus information that you have and you apply it to COVID, whether some of it's real or not, and that's where the fear sets in. That's where we talk about vaccine hesitancy. Like people are really nervous to get this vaccine because they worry about other periods in our history where vaccines have been have had complication. There's even racial concerns, right? Certain populations have not properly been treated in the past by biomedicine, and they worry, right? So there's geopolitical issues. So you're asking me, well, I mean, I feel that first of all, I probably represent the demographic that the vaccine was tested in.
Yes, that's true.
Number
Yeah.
one. Number two, I support many people that are pregnant, but I'm currently not going to be pregnant. So, and even if I was going to build my family further, we know that its safety in sperm and gametes looks to be very high. So, like, I'm not worried about it. But also, I'm not allowed to be the first person to get it. They've given it to long-term care people, and
Yes.
I'm sort of a quasi frontline worker. I mean, I'm not working in the ICU, although I do work in the hospital. So I'll have to see when we're offered our doses. But I would consult with my physician, but I feel very comfortable asking for it.
So then I have a question here, and I'm going to apologize now because I don't see other questions coming up, and I'm sure we'll find it once we actually stop the podcast.
Right.
Or sorry, the video. And so there's two questions. My daughter-in-law is 11 weeks pregnant. If she has the opportunity to be vaccinated, does any immunity she gains transfer to the baby, or does immunity not cross the placenta barrier?
Those are great questions. Those are great. There's a few questions actually embedded
Yes.
in that one question. So first of all, if your daughter gets vaccinated, so obviously the choice, I mean, she's leaving, so no one really knows the ideal trimester to be vaccinated in. Is it the first, second, or third? We're always very wary of the first trimester because when you look at human development, the first trimester is the most critical. In fact, most of the first trimester is referred to as the critical period. It's when all the organs differentiate and a lot of them gain their function. And so if anything was bad to happen, which we don't believe it would be the first trimester. So that's why many are very sensitive about first trimester vaccination in general, even though with the COVID vaccine should be fine. So that's question number one: is should she or she not be vaccinated? And that's a decision again that we discussed about what other high risk behaviors she has. Is she working as an ICU nurse? Is she a stay-at-home homemaker? Does she have any other comorbidities? Is she obese? Is she over 35? Does she have heart disease, lung disease? These would all be factored into the decision to vaccinate. So let's get past that. Let's say she does vaccinate. So then the question is, can this vaccine cross over into her baby? So there are different vaccines that we talked about. There's the newer mRNA vaccines, which are these little packages of mRNA that sit in these little molecular envelopes. There are the older platform vaccines like AstraZeneca is developing, which is like an adenovirus platform, and all of them should theoretically pass the placenta, right? They're not massive molecules,
Right.
and so they could pass. The good news is that the fetal immune system is not really developed yet, so it probably wouldn't be able to build the machinery that's required. So that's not as worrisome or concerning. But what will probably happen is the mom will, if she gets vaccinated, will develop the ability to build antibodies against COVID. And that will passively travel across the placenta. We refer to that as passive immunity. And so that may have some theoretical protective effects, but we don't know, because inflammation in the fetus also is not something that is totally desired. But the hope would be that those antibodies that the mom develops would just block the COVID before it even got out of hand. We know that from studies of women who have been affected by COVID, their fetuses, when they check blood and other secretions when they're born, show antibody. So obviously antibody is coming through the mom vertically.
Right.
So the short of it is, that's, I think, part of the reason why we want women of pregnant or reproductive age to be vaccinated, is that they probably are protecting their fetus. And so, yeah, it would make sense that it would pass through.
So then carrying that further, if a woman already has their child and she's a lactating mom, she gets vaccinated, would that apply the same way through the breast
Right.
milk?
Right. So, I mean, so again, going back to the basic physiology, I mean, lactation has many benefits. So one of the benefits is nutrition, right? So obviously when a baby's born, obviously formula is an option, but it's a very convenient form of nutrition. But then secondarily, because even if you could supply the forms of nutrition, there is this passive immunity effect. Antibodies do travel in mother's milk, and they will go to baby in certain levels. And so there was always this thought that it does prime the immune system, because we know that a baby's immune system, a newborn's immune system, doesn't really mature until about 2 to 3 months, and it's ongoing. So I think those would be benefits that would carry over for the whole COVID scenario. And that's a good thing. Yeah, I mean, that lactation would provide that possible avenue for antibodies.
And just to be providing an example, so when I was breastfeeding my child, she never ever got sick. And I'm giving you a sample size of one, but just so you know that there are definitely health benefits through mother's milk, for sure, for the immune system for the baby.
Yeah, it's it's something that we want to empower women to do, and we wouldn't want them to have to compromise. Like, the idea is we just don't want there to be any discrimination. I mean, if there was some good reason why pregnant women or lactating women should not be vaccinated, then yes, we need to stop them. But if we can't make a good case for it, then we could be removing them from a very important medical maneuver. So now, I mean, I wouldn't want someone to lactate just for that reason, but I think it does have those benefits.
Mm-hmm. This is also interesting. I mean, me being posed with a question, my automatic is a little bit of a hesitation, because I am that person that, oh, if something happens to them, like if 5% of the population gets X, Y, and Z, I would be that person, right? So makes me a little hesitant. But, and I guess also the other hesitancy I have is it hasn't been, in terms of statistics and a documentation of the vaccine, well, it's only been 3 months. But having said that, I do feel more comfortable because it is mRNA versus the older way of creating vaccines.
One of the questions that rolls out, a lot of people are very skeptical because of the speed at which the vaccine has been available. But what many don't realize is, or maybe they haven't put it together, but hundreds of millions of dollars of investment by governments around the world have been funneled into R&D for vaccine. but a lot of it was just to offset the cost of producing lots of doses of the vaccine, right? So the idea was, it wasn't just to have the vaccine and say, okay, we've got the vaccine. It's now going to take us another year till we can generate enough doses to vaccinate everybody. Both the development and the production were being done simultaneously, accepting that maybe it was a dud investment, that possibly some of these candidates would receive all this funding and that their vaccine would not work. So many governments were hedging bets, saying, we're going to pick the top contenders, and we're going to give them, extra funds so that not only can they build, but they can also develop, but also build the actual inventory at the same time. So it was a risk. I mean, it still is, because we don't have the final story, but it looks like it's a bet that's paying off. And certainly the Pfizer, the Moderna, I mean, if you're following this from the beginning, there are very competitive applications and tenders to receive that government funding. Look, even Pfizer's been around for a while, but Moderna, they had never launched an official commercially available vaccine before. It's the first time. But I think medicine's checks and balances have improved a lot to allow that to happen.
Sure. Yeah, when there's so much money funneled into it and so much more manpower, there is a better capacity to develop something at a greater speed, right? So, yeah, thank you for saying that, because of course, again, it stokes up the fear. It's like, oh, it's too fast. And, how can it be good? How can it, yeah, it is impossible. But, coming from this angle and seeing what they have produced, it's pretty impressive, really, I think.
Yeah, but what drives me a little, what disturbs me sometimes is that, why do we have to have this conversation about whether it's safe to give to women or not? Really, why are women not being included in these trials? I mean, there's such a big push to include women of reproductive age, or sorry, pregnant women, with the same kind of consents, risks, and benefits offered to them. I mean, I don't. I guess the problem is it that much more ethical to exclude them from the trials and then have this conversation of, okay, we believe it's safe because of the other experiences, or should we not just be a priori right from the beginning looking at this population? And I understand that it is trying to protect people, but it puts us all in a really tough place to make that case for it when they haven't been studied. So that part I understand. I mean, you could see a reproductive age woman saying, forget it, I'm not getting this vaccine. It was never formally studied. And give it 6 months, give it a year. Let's see what happens to all the other population. So I absolutely can see patients foregoing it. And again, using frames of reference that maybe not apply. Like, in Canada, we had the whole thalidomide story. And even though it's a very different situation, it was a drug versus a vaccine, people have selective memory, and you see a bad outcome, and you really don't want to chance it, considering that there are alternatives to managing COVID, right? Like wearing masks, washing, and watching your distance.
Yes. I mean, okay, so you're talking about practical ways to avoid. And then for those of you watching, I mean, the other piece also on top of that, like I would say all the three W's, plus, how are you taking care of yourself? Why is it that one person, you'll take two healthy people and one person, let's just look at regular colds and flus, right? Some person gets sick, another person doesn't. So what is it about their own personal immune system? What are they doing? What are they eating? How are they exercising? All those kinds of lifestyle medicines that can impact your natural ability to ward off colds and viruses, never mind COVID at this
Right.
point.
Oh, there's no question that at COVID's onset, I mean, it was essentially a year ago that we started hearing that COVID was coming. Supplementation was one of the first default positions. So vitamin D, vitamin C, any of the supplements that are known to boost immunity were being promoted. In fact, I started taking a multivitamin more frequently just because I was worried what you'd say to me. But yeah, like that. But again, who are the high risk people? The high risk people are the people that are overweight, heart disease, lung disease, diabetes, any immunocompromised groups. And so, yeah, vaccination, immunity, fighting off viral illness. The problem is it's not a perfect approach, because there are many super healthy people that have succumbed to COVID or that have had serious morbidity from it. I mean, there have been elite athletes that were affected by COVID.
Mhm.
And these are, prime specimens, people who are taking probably more vitamins than we can imagine. So it's the virus is not that simple.
You're right. I mean, it is not that simple. And yet, but if we were to look at, we don't get definitive information about the details of the numbers, right? So what is the true population of patients that are contracting it? Yes, you're saying that there are some healthy people, but isn't the vast majority more immune compromised, right? And
Well, you mean those that are becoming affected by COVID versus those that are, sorry, COVID positive versus actually symptomatic? Yeah, I mean, there's no question that the limit there is the testing, right? I mean, we can do all the modeling. That's what modeling is all about. Modeling is there to look at, we can never test every single person. So if we test a lot of people in different pockets, we can sort of look at these demographics and say, and we do know some of that information. We do know that certain ethnic backgrounds are more susceptible. We do know that certain socioeconomic situations are more susceptible.
right.
And those typically are linked to nutrition and overall health. So there's no question there's a role for overall well-being.
Mm-hmm.
But that's a little much more difficult to change. And so,
How do you mean?
yeah.
What do you mean much more difficult to change?
Well, if someone, I mean, look, if someone's living in a certain part of the world or in a certain part of the city, and we tell you, yeah, there's a lot more COVID there, well, it's very difficult to move them out of that location. I
Right.
mean, if that's where
Gotcha.
they live.
Yeah.
Whereas if we set up a van with a vaccination program, that, I mean, socioeconomic situation is a much deeper condition that is super important, but it is not easy to change. And COVID, unfortunately, I don't think has helped our economy in that regard, and as I think has driven the divide more so. But I'm happy to answer any other questions you have about where COVID would fit in for preconception or.
Well, like I said, I don't know why I'm not getting the questions. It's just not working here.
I can make up a question. So
Okay, let's have you make up some questions for Pete's sakes, because I don't actually see the questions here. There's something wrong here. I don't know why.
right.
Comments. Oh, wait. Maybe no, it's not showing up. Darn it. Let's see. Okay. Well, why don't you go through
Yep.
what are some of the questions that you get most
Yeah.
common?
So one of the other questions that we're getting is obviously around travel and safety in early pregnancy, considering COVID. That again, that's obviously everyone has their own. It's a very confusing area because we're living in a lockdown, and yet you're still seeing planes going overhead and people going places. And so the question is, where does the vaccine fit into that? Well, that's challenging as well because vaccination again is so far looking like very much a developed world situation. There's a lot of parts of the world that will be delayed in terms of receiving vaccine doses, and so it's great if you're vaccinated, but if you're traveling to somewhere else, you might be assisting in the movement of the virus, and vaccination isn't perfect. So I think right now is if people can stay put, it would be helpful. I understand that people do want to move around and they're getting tested to help support that movement. But yeah, the messaging around that about travel is really tricky. We're still trying to tell people that the value in travel is limited unless you have to go. But there are still people going around, and I'm sure most will be fine. But we're telling everyone to respect the local authority in terms of locking down and trying to limit travel to essential.
I think you just hit the nail on the head when you said most of the people will be fine. Because what I see in media is that, you're always going to, media and news stories, it's not going to be effective unless it causes a lot of fear. And, when we're looking at data and deaths, yes, I get it. And it's a real thing and it is posing a huge problem. But if we're going to look at sheer numbers, a lot more people die of complications from
Blue.
diabetes and all the, they're not listing those kinds of numbers, right? So to put things into perspective relative to all the other types of ailments that exist in our society, right? I think that would provide more of a balanced perspective versus just this one-sided hyper focused on COVID, which is definitely real. I'm not the anti-masker. I'm definitely
Yeah.
not, you know what I mean?
Yeah. Well, I mean, I think that the problem is that most of us in our day-to-day dealings are not going to the ICU at Sunnybrook Hospital. We're hearing about it on the news, but we're not actually seeing what it's like to have to triage patients because we don't have enough ventilators or we're at a certain capacity. I mean, we don't want to get to a point where what was happening in Spain and Italy,
Oh,
where they were splitting ventilators into two because they couldn't support enough people. So that's what public health is all about. It's all about forecasting and pivoting away from a problem before it even gets there. And so that's what's scary in the province right now is that we have a ICU capacity. And again, ICU is this sort of hidden away place that you don't see when you walk down the street, but that's what the place that you need if you get very sick. And the other thing too that you were sort of suggesting is that COVID is just one condition. Although it was the condition of 2020, it's one condition. But there's so many other conditions that we need to treat through the hospital, through our medical system, that we can't if COVID overruns us.
yes.
And even looking like I do surgery, and all my surgery colleagues are increasingly getting worried that there'll be another shutdown of semi-urgent or elective cases in lieu of hospital capacity, right? If the hospital doesn't have enough capacity,
Yes.
you can't do your operations.
Yes.
And so it's been that spin-off effect that's really where COVID has had its biggest mark. And like I operated today, and I was worried that I was going to be told, sorry, there's not enough resource, we have to shut it down. And so, not to go completely off topic, but that is the topic of COVID, which is it's the opportunity cost of treating COVID versus all the other things that we need to
Right.
treat.
Yeah, that's really, really well put. And it's so true because I know two cases where the women had cancer, some form of cancer,
Mm,
and they were not able to go to surgery because they're not high priority relative to some other
right.
people. And of course, a woman with cancer is thinking,
Mm.
what are you talking about? Of course, I should be top priority, right? So,
Well, I mean, cancer, I believe, like, so all these conditions, I mean, by the way, I'm very happy to have our conversation go whichever direction you want to go. We could go from pregnancy-related
that's
vaccination to
okay. This is a
cancer,
conversation.
well, no, I mean, look, I wear different hats, and one of them is, I'm involved in the Ontario Medical Association and the hospital, and obviously these are decisions that are made very carefully and with a lot of thought. And I know that at least in our hospital, what happens typically is if we hit that ICU critical bed because COVID's getting out of control, messaging is sent to the divisions, the departments, and each department has to do their own triage. So, for example, in the case of gynecology, we are prioritizing our cases and deciding, yes, cancer is obviously the number one, things that can't wait. So we're not saying that someone that has some non-cancer situation or condition that they're not a priority. It's just if you wait another month, your prognosis won't change. Whereas if someone has a fungating cancer, they may pass from that. So I mean, we're lucky in our society that we have the capacity to still maintain, but we
So,
want to maintain that.
Okay, now going back to the fertility piece then, because on the 26th, we're going to go back to the lockdown. And so, does that affect how women and couples are running through the fertility clinic? Are we lowering the numbers? Is it keeping the same? Are you prioritizing certain conditions?
Well, we're very fortunate in that at least fertility has been declared from the statements of the Canadian Fertility and Andrology Society as an essential service. So we see ourselves as essential, and we've essentially broadcast it. We've said, like, we are essential, and we are in position to protect our patients. We've created protocols that allow us to maximize all of the, all the W's, the washing, the wearing, the watching, and in the interest of helping women, right? The fourth W, and men. So, which is the W upside down. So, so we like, that's what I've been telling many patients, because that's a big fear, is that wave one, even though wave one was a shorter wave than this new wave that we're in, I would argue that's been one long wave, but wave one versus wave two. In wave one, it was a shot to the face. Like, we didn't have any PPE, we didn't have any protocol, and now we do, and it's a lot better. So what I would say is, at least in the fertility clinics situation, it will stay the same as it was post wave one, and that should work, at least from our perspective. So that should reassure patients that we're not closing. We are maintaining the same flow, the same treatment of partners, which I know has upset some patients and has made them feel as if we're disenfranchising the partner. The goal is really to protect as many people as possible. But I look at the glass half full, that in spite of all this, we're able to stay open and we're able to keep caring people. So you can tell people till you're blue in the face that 1 or 2 months is not going to change their prognosis. But when it's you and you know that your IVF cycle is being delayed by 1 or 2 months, that's a big deal. So we're fortunate now that we do not have to, those delays will not happen.
That's great. So then I will also announce that at Alive Holistic Health and all the regulated health professionals across Canada, we are also allowed to stay open as well. So we weren't able to in stage one, obviously, but now they see. And as you know, we do a lot of work for fertility as well. So, you know, we consider that a part of essential service, because as women going through fertility, it's like fertility doesn't wait. Every month.
Well, I mean, look, back to the vaccine. So, you know, again, everyone's looking at the vaccine as the magic bullet. So we have the vaccine, let's go back to normal. Let's ignore that COVID's going on. And I need to stress this, and everyone's stressing it, that the vaccine is COVID 2.0 in terms of discussion. Like, it is where we're heading, and that's where all of our discussion is, but we're not abandoning the W's. We're not abandoning any of that. In fact, that's not the messaging coming from the city, the province, the country. The messaging is, you will continue the W's until, as a society, we vaccinated enough people to actually make use of it, make use of its herd effect. So we're going to be masking and PPEing for deep into 2021. I just can't see it not being there.
So I finally found something. I don't know why there's only one comment. It says early vaccines. This is Dr. Tanya Wild, the naturopathic doctor. She says early vaccines like tetanus, polio, and MMR vaccines saved millions of kids and didn't have much research before these vaccines came out. I think there's fear around the lack of research, that vaccines themselves have a lot of history of safety. Very good. There you have it.
Yeah, well, I mean, that's just it. Like, for COVID, we're relying on empiric evidence. I mean, you know, evidence doesn't always come in the form of, like, it comes in many different forms in science. Even though all those vaccines were built on much different technology than the modern COVID vaccine, but all the more reason why we should be comfortable with it, because those vaccines, which had a much larger burden, the side effect profile was much worse. Now we're using something that, yes, came by more quickly, but is underpinned by a much sleeker science, higher tech, more streamlined. So I agree with that comment. But
I love this. I love this, that there's mutual agreement, because we have 3 different kinds of practitioners here. So we've got a reproductive endocrinologist, Dr. Tanya Wild. She's a naturopathic doctor. So her and I are more on the natural camp. So
right.
we're both, you know, it's not that, so we're definitely not anti-vacciners, you know.
Why isn't Dr. Wild on the screen with us? She should be here with us.
She should totally be on. I don't know. We could, hey, Tanya, if you're there,
Come on,
join us, and we'll hook you in.
Well, remember, Mary, we always do firsts on your show. So this is the first ever COVID vaccine talk for Fertility Talks Live.
Yeah, that's right. I don't know if she's there.
Yeah, it's pretty amazing.
She might be there. Tanya, come on.
Come on. But Mary, it's pretty amazing if you think about it. Like, the vaccine was released this month.
I know.
The first week of December. Like, the press releases were all coming out then. The first doses were a week ago. Like,
it's insane. Yeah. I watched the first dose on live.
There's a few of them that we were watching.
Yeah. She can't come on. She's got her kids.
That's okay.
She's on. Fine. Thank you, though, Tanya, for your excitement. It's awesome. Thank you for the contribution.
That's okay.
So, and the point in all this is that, you know, I don't sit on a particular camp, and I think some people that may look and judge people that are in natural medicine and think that we're all just
anti-vaccine
and anti-vacciners, and We're
Right.
not. We're very science-based people. Well, at least I'll speak for myself and Dr. Daniel Wild,
Right.
right? But I think for the most part, really, we want to learn the science first, as you
Well,
all.
I mean, well, vaccination, I think if you look at many of the biomedical maneuvers, vaccination is as close to holistic approach as you're going to get because it really is working on the body system. If you don't have an immune system, you can't be the vaccine just doesn't function properly, right? So to your point, and I'm curious to see if this data will come out, is who vaccinate, as you said, like who is more successful at vaccinating at seroconverting? Are it people that are in better shape or people that are in worse shape? And that's really where your
Right.
job is going to be so critical, is getting people's immune system ready to deal with this call of the vaccine. Uh, but I think we do have to discern between the anti-vaxxer, like the person that says, I don't care which vaccine it is, I'm not getting it, my kids aren't getting it, and vaccine hesitancy, which is this new, it's the first time I've heard this term um, when we were talking about COVID, which is, I don't think vaccine hesitancy means you're anti-vaxxer, it just means that you're hesitant. You're like, I'm not going to be the first person to get this. I want to wait and see.
Hmm.
And so I get it. I understand that.
Well put,
But
because I am a vaccine. What did you call it?
hesitancy or hesitant,
Hesitancy.
I don't know if there's a
I
noun
am
for
that
it.
person. And in fact, and I'll be clear and I'll be open and honest about it. I don't vaccinate for the flu virus, for example. I don't really get the flu, actually.
Hmm.
So I am that person that practice what I preach and I try to be as healthy as possible. But, there are certain things that are unknown. And like you said, there's some very healthy people that contract COVID and they're, not in great shape. And
Well, I mean, look, virus, yeah, sorry, contracting a virus-based disease does require contact. Very often requires contact or some type of exchange of fluid. So if someone's amazing at the W's, then I mean, we can't live in a bubble. You don't live in a bubble. You're exposed to people, you're exposed to your kid. You're out there in society. But I guess theoretically, that's what many people are doing. They're just using the W's and hoping that they can avoid, in this case, COVID. But I think I know the vaccine will help open us up. Oh, there she is.
there she is.
Oh,
Hello.
hi.
I am totally in kid mode.
That's okay.
So I don't know if can you hear me because I don't have a headset.
Oh, that's okay. That's okay. I love it. I love the spontaneity. So
Like a
No,
little
it's
bit of
like
a mess just wrapping Christmas gifts.
no. It'd be awesome if someone else just kind of like if like maybe Isaac Bodrosh just came on or Eileen Davila. We get all these famous Doug Ford.
Doug
Hey,
Ford,
wouldn't that be
okay,
great?
Dougie,
Hop on.
just get Dougie to come on. Well, that's what you
Dougie.
need. Uh, but well, you're the host, Mary. What else would you want to talk about? You have me for another 8 minutes.
Yeah, and then we're gonna shut it down. Normal, like these things are getting longer instead of shorter for Pete's
Well,
sakes.
well, I'm curious. So how would Tanya, like, meaning what are your clients saying or patients?
So I would say that there's a divide a little bit, which is a little concerning because I think there's a lot of fear, which is unnecessary because that comment that I had made previously in the comment section that basically there's so much history behind vaccines that offers in and of itself evidence that the vaccine will be safe. And as you said, the more people get vaccinated, sure, we might see more cases of Guillain-Barré syndrome and Bell's palsy, but these are side effects that weren't really recognized as a big deal. Obviously for the people who get it, but they're short-lived. And I think because there's so much media around the vaccine, people are more aware of it, but people get vaccinated all the time with all the other vaccines, and the percentage chances of that happening or those side effects occurring
Oops, is very, very low. Is what she's trying to say. It's a really nice look going on right now.
I hope she didn't get the vaccine today.
Yeah.
But no, I hear. But the only issue is that the history of vaccination is quite dark. Like a lot of, and when you watch the American feed, again, there's many different groups, different cultural groups that are very scared of vaccine because of what it represented. Especially I know in the African American community in the U.S., there was a lot of misrepresentation, unethical practice in terms of developing these vaccines. And so that's one of the main points that many of the proponents were making, at least in the American feed, is they were saying, look, like on these vaccine boards, on these medical advisory boards, these scientific committees, these research groups, they're multicultural. Like all ethnic groups are represented here. This is not just a white male dominated event.
Right.
And I think that should make people feel more comfortable that all groups are being taken into consideration, except for the pregnant female. That's the only one they left out traditionally. So yeah, that's it.
Well, I think the only other query, I suppose, is, well, how long will this immunity last, right? When you get vaccination, and that's a whole, but no, truth is, we don't know.
I mean, right now they're saying that, well, they're all based on a series. So you have to, like 3 or 4 weeks apart, like injection 1, then injection 2. And then right now I think they're estimating, because they don't know, but they're estimating it's going to be a yearly booster.
Oh, okay.
And then, but again, I don't know. There she is.
She's connecting again.
She's really holding
You're
on.
back. You're back.
I don't know how far I got into that or how much you heard, but basically there's a lot of fear, and I think it's just disproportionate because of the media and how much is actually being discussed in the media about what the side effects are rather than the pros.
Well, absolutely. I mean, but that, again, that's what negatives. Yeah,
she's exactly. like Tanya's like a cat. Like she's got like 9 lives. She kind of kept coming back each time.
She won't go away.
She won't go away.
I'm so sorry. I will pause, not speak, unless asked.
No, it's
no, it's good.
Sorry, I'm just listening.
No, well, I was just going to comment. So I don't know if you know this, Dr. Baratz, but
Nope.
Dr. Tanya Wild and I are doing a weekly podcast, and it's called Embrace You First. So maybe at some point you can jump on that one, because that's a weekly thing. And it's
Can I Zoom bomb it like Tanya to our session? Just show up. I'll just hack in. Well, that's been one of the concerns with Zoom, right? Is the fidelity of it and the encryption. Can people just jump in?
Well, not so much for the paid version, apparently. But you know what? Yeah. That's early phase. Now it's been almost a year. So
well, why don't we take the last couple of minutes and just talk a bit of what is this podcast about? What are you guys? What are you?
I love it. Now you're interviewing us.
I'm reversing. I'm pulling a reversal.
Note, I'm not a total vampire. She has to invite me into the room. Yeah. She has to invite me into the
vampire. Soon you're gonna flip your screen upside down and be hanging from a trapeze or something. Okay, I feel like I've wow.
I don't know how to do that. That's awesome.
You know we're a day away from Christmas Eve when all this is happening.
Yes, we're just having fun.
Just before I go into that, just speaking about Christmas, so that Sanjay Gupta, he's had his whole series on COVID factor fiction. He has one of them on the Santa Clauses, like the guy, the community Santa Clauses, how they have to adjust what they're doing because of COVID, and it's really freaking the kids out. No, because like they're not used. They want to sit on Santa's lap. They want to be there. And I didn't listen to the whole thing, but anyway. So tell us about you, Mary, about your next Embrace You, Me. What that?
Embrace you, me. Embrace you and me.
Yeah. Well, that's the next podcast. But it's called Embrace You First, because here's the deal, right? Like especially for women, and we don't want to just say women, but we tend to care for everyone else. And who's last on that, lineup of people to care for? Ourselves. So we're here to tell women and men to take care of you first, because ultimately, if you don't take care of you, you can't take care of anybody else. Right? So
it's not you're not being selfish by doing that.
No, and I like to eliminate that word. I call it self-care.
Self-care. Okay. No, that's good. Well, that's an important line, right? Because sometimes people hide behind that and they say, well, I'm just trying to take care of myself. But well, thank you for doing that. Well, I would love for there to be a male component of that, because I need to embrace myself a little bit.
There you go. Right. I know, because you're always working. You work like 7 days a week. Maybe 8 days a week. Eight. Well, I'm doing it. I'm bracing. You're bracing. Yes.
This is how
we talk about the 4 pillars. Nutrition,
yeah.
Exercise, sleep, and embracing you, but like the mindfulness. So the physical for sure, but
relationships.
Well, I'm sure COVID has really challenged that big time.
Well, we've had
Yes.
a great conversation that was just released. It's actually called COVID Connection, right?
Who-
And so we talked about how it's impacted us and our ability to connect with others. How well are we able to um, understand that connection through a mask when we know 60 to 90% of communication is nonverbal, right? So we
Right.
miss a lot of the
Oh, we missed this whole, you
yeah.
know, it's so interesting because, and I guess we're getting near the end of our time, that at least from the biomedical practice, because now, you know, I assess patients completely but virtual. We only see them when we're monitoring them. And by then we've already committed them to some treatment path. But the whole physical exam has really been put into question, because on one hand we say, oh well, we have ultrasounds, we have all these imaging, why do we even need a physical exam anymore? But the physical, you both could attest this, the physical exam is really, it's part of a ritual. Like it's a way of connecting with the patient, even if it's a limited physical, which is examining their shoulder. It's a way of, you know, creating a trust. And we've completely, I mean, biomedical practice has abandoned it considerably. And for you guys, it must be a big challenge too, because you're also engaging patients both emotionally and physically. We've gone way off topic from COVID vaccine, but I do appreciate what you're getting into. Embrace you.
So I do agree with that to a degree, like to a certain point with the physical exams, because they have changed it now to every 3 years where you get a physical exam and blood workup with a general practitioner. So our exams also became limited, but there are things that I feel like I would be missing, but thankfully there's, you know, the touch point with the general practitioner, but even just like examining and finding thyroid cancer and breast cancer in a few patients, it's been very far and few. I would say the majority of the time I feel quite confident in my ability to just practice with telemedicine, just because of what I focus more on lifestyle medicine. But if I could jump back for just 1 second, since this whole topic is on vaccines, and just mention that when people get the honor or the ability to actually get vaccinated, I really promote just supporting your immune system in your body before getting it, just feeling like you're in a good place. And that if you do get a little bit of side effects, just, you know, if you take vitamin C, vitamin D, rest, avoid Tylenol. If you are going to, you know, get it, you get a side effect of the fever, just so that your body is actually generating a natural immune response to getting the, you know, the mRNA. So that way, if you do encounter the virus, your immune system is more prepared by not suppressing it with Tylenol or Advil after getting it. Like, I don't know if you have ever, like, because that's a common thing that
Fever.
patients do. Yeah, the
It
common
can
side
be,
effect is
yes.
a fever. Yeah. And so then to actually then take Advil or Tylenol can maybe affect the ability for the vaccine to actually work effectively, unless you're
Yeah, I could see that. Like I could see the theoretical part to what you're describing, like meaning you're trying to prime the immune system. So why are you suppressing it? You got to appreciate the immune system has many arms to it. Like it's not just
sure.
antibody production. Like there's so many things. I think we'll have to agree to disagree on that one, because
Okay, sure.
I do
I wanted
believe
your
in.
input.
Well, I mean, look, I don't want someone to be roasting at home, and if a bit of time is to make them feel better.
Yes.
But the good news is that those fevers that come from vaccination are probably benign. Like as you said, they're just a normal.
Yes.
Yeah.
How good it is, I don't know, but it's not like if someone gets a fever and they're pregnant, or they get a fever and they're like, they can't, they're becoming compromised. That's different than these low grade fevers. So
Sure.
I don't have a big issue with them treating or not treating.
Right.
But I mean, Mary,
Just,
are you gonna it's been an hour together, so
Yeah,
I
we're
mean, I
gonna
really,
go.
are we
so
gonna?
we'll exit. Yes.
But it was fun. It was having Tanya like sort of Zoom bomb. It's what I call it's called a zomb.
Thanks for letting me Zoom bomb, Dr. Ratz. Nice to meet
Thank
you.
you. You
I
spiced
like
it up.
the
We'll
bombs.
see you
Yeah,
on Brace
thank you
You
so
first.
much. Yes.
Yeah,
yes,
I'd like to come to Brace You first.
Okay.
Yes, that
Sounds
would be
good.
lovely.
All right. And before we hang up, so that's exactly where we want to go. So check out our Embrace You First podcast that just came out on Tuesday, yesterday. And we did talk about connection, and especially during this kind of time. And we gave you some tips as to how to navigate this. And you can find it on embraceyoufirst.com. So subscribe, Dr. Baratz, and share with all your patients.
Try
And
my best.
we have, if you have an iPhone, you can go through Apple Podcasts and look us up. Anyway, and check us out on Instagram. you'll find us. And also for Fertility Talks, I now have 181 podcasts or video posts. So totally subscribe there because you'll get all things fertility on it. All right. So until next time, it'll be in the new year. Love you guys. Thank you so much, Dr. Baratz, for being here once again, first of so many things. And thank you, Dr. Tanya Wild, for zombing. I like the zom. Okay.
Thank you.
Enjoy your Christmas.
Okay.
Yeah, thank you.
And
Happy
have fun
holidays.
on everything else. Happy holidays.
Thanks.
Bye,
Bye-bye.
everyone.
Bye-bye.
Oh, wait, we're still on. I gotta stop live stream.